Hi everyone, my name is Douglas Nelson and I'm the founder and creator of Precision Neuromuscular Therapy. The purpose of this video is to give you some insight into precision neuromuscular therapy and some of the underpinnings of the work that your therapist might be doing when you go to see them. First, what distinguishes precision neuromuscular therapy from other types of massage is not how it looks, but really how it thinks. If you imagine some other type of massage, I would assume that you could come up with some sort of mental picture about what that style of massage looks like. That's not really true for precision neuromuscular therapy, in that what you can't really see are the mental processes that the therapist is going through as they're executing the work. You know, I can't help but kind of make the analogy to golf in a way. In the same way, I can stand over a golf ball and I can pretend that I'm sizing up some sort of putt and whatever, but in reality, I have no idea what I'm doing. I'm just standing over this golf ball, and somebody who really understands what they're doing is really calculating factors I don't even know exist. And the same thing is true with massage. As it turns out, the idea of putting the little ball into the gopher hole is really simple, but simple and easy are not the same thing. It's really hard to do that if you've ever tried to do it time and time again. In many ways, massage therapy is the same thing. While massage looks very simple, it's just using hands. There are no tools, there are no fancy anything. It's just educated hands working with the musculature of the body, but actually to do that in a way that creates truly predictable results on a consistent basis turns out to be really, really difficult. And that's really the skill set that the therapists that you're seeing, that's what they have. That's what our training is really all about, to give them this deep anatomical knowledge so that they understand the kind of systems theory with the muscles as applied to the body, so that when you come in with some complaint, something specific, their job is to think about, okay, here's what you present with, but what are all the factors underneath that? In a way, what's the context that creates the outcome? Because you can't just change an outcome without changing the context that created it. I think we all learned in 4th grade, you can't change something on the right side of the equation without changing something on the left side of the equation. And that's a really important principle. It's not that you come in and we just take care of whatever symptom that you're having. In precision neuromuscular therapy, we call it PNMT for short, our therapists, what we train people to do, like the therapist you're seeing, is to really have that deep contextual understanding of why is it potentially that you have the symptom that you're presenting. So we'll address that, of course, because if that's what you're coming in with, we want to acknowledge that and discover that. But what we also want to know is what are the underpinnings around that? Who else should we be thinking about? Back to golf. I'll give you another example of this. Let's say, for instance, you come in with some pain between your shoulders, or maybe even an elbow pain, which is very common in golf. So you'd think if you were coming in, the therapist would actually just treat your elbow or just treat your middle back, because that's where you're having the discomfort. What we train people in is really to think in a much broader perspective. So for instance, a lot of that might be some evaluative and assessment stuff. So your therapist might be assessing your hips, because here's the interesting thing. If you're a right-handed golfer, for instance, just to take that sport, if you, in the swing, right, when you turn on the ball, your hips need quite a bit of what's called internal rotation. So the bottom line is this: what your hips can't do, your low back tries to make up the difference. Think about the sequence of events. So you have limited range of motion in the hip, not from some arthritic change, but just actually muscular restriction, so the hips don't move enough. Therefore, you can't get enough power in your swing. You may try to compensate by trying to get that rotation in your low back. That may lead to low back pain, or you may try to do that. You may have restriction in your upper back. Those muscles are actually going to be doing too much because your hip is doing too little. And because your hip is not participating fully in the process, now what you know is that you're just not hitting the ball as far as everybody else around you. And so you actually try to make it up by swinging with your arms, and that is going to create elbow pain. So your presenting symptom might be pain in the elbow, but it's because the elbows are doing too much because your hips are doing too little. And that's really a systems way to approach the body. And it actually, for us as therapists, it makes our work really fun because we get to do that sort of detective work. And it's not just about treating the presenting thing, it's really the really fun aspect of diving deep inside of it. And I always tell my clients, boy, I hope you had as much fun as I did today, because I don't think they see all the kind of mental gymnastics that are happening. All they know is, I treated here, and then I treated here, and then I treated here. And oftentimes, again, we hear from people, how in the world did you know to go there? And again, the answer is just straight out anatomy. Nothing fancy, just understanding how things work together. So that's the essence of our training. It's not about any one technique. It's really about using lots of different tools. So we're not married to any particular technique. If you're married to a technique, what happens is, if you start to fail, what you do is that technique, more often harder or softer, you just keep tweaking it a little bit because that's your go-to thing. In our trainings, what we really emphasize is, don't marry the technique, just marry results. Whatever gets results, that's what we want to focus on. So what you'll find is kind of the treatment process is very fluid, very flexible. You'll see your therapist trying one thing and then approaching it from a different way, maybe the same muscle just in different positions. They'll have you moving around the table just a little bit, because doing it in just one way is like, perhaps you're looking at buying a house and you look in one window and you think, I don't really like the house. Well, you've just seen it from one window. What you need to do is look at it in multiple views. So your therapist will do the same thing with your soft tissue. They may use some movement kinds of things. They may use static pressure. They may use more gliding strokes. They may take you through a range of motion and look at what your range is in different areas. They may take you through some kind of orthopedic testing. All of this is just information gathering, really to set the stage to understand the process. It's all in an effort to create real and lasting results for you. And again, that's what the essence of our precision neuromuscular training is, and that's what the person that you're seeing has gone through this process. We don't give certification, we make people earn it. And if you talk to your therapist, you'll see if they've already gotten their certification. It's not just something where they took this online thing and got a nice piece of paper and whatever. I mean, they have really worked hard to earn what they've gotten from the seminars. And if your person is taking through the process but not yet quite certified, again, if you talk to them, they'll tell you it is a challenging thing. It's a little bit, I'm a new cello student and never played cello before, just started a few months ago. I suppose the number of hours that I've actually spent with my teacher, not that much. But the number of hours that I have spent outside of the studio practicing in my house, that's a lot more. And the same is true with the people who've taken the seminars. While you look at our training, I mean, the kind of core level of our training is about 100 hours or so. But that's not what your therapist has done. I mean, they have spent many more hours on top of that, studying and trying to understand the work, because it's complex and it's challenging and it's rewarding. So I hope that you really enjoy your session with your therapist. I think that you will find the work also really engaging, really fun, and it's a rich experience for everyone. Thank you so much for your interest in the work. And I hope this video has answered some questions. Any other questions, do see your therapist and they'll be able to expand on these ideas. Thank you again.